Well, ladies and gentlemen, welcome to Development Discourse, where we ideate for Africa. My name is Patrick Okigbo, founding partner Nextier. Nextier is a multi-competency advisory firm focused on trying to fix Africa's complex development challenges. And healthcare delivery is a significant development challenge. On average, African countries spend about $30 to maybe $150 per capita on health annually. For comparison, global health spending per capita is at about 1,100, whilst countries like America could spend upwards of $10,000 per capita. This disparity is quite obvious in our everyday experiences, but I mean, it became very clear to us during the COVID-19 crisis. My guest today lives in this world of global health. He's a Nigerian epidemiologist, public health physician, and the World Health Organization's Assistant Director General for Health Emergency Intelligence and Surveillance Systems. Dr. Chikwe Ihekweazu served as Nigeria's Centre for Disease Control, DG, the agency responsible for protecting public health and safety through the control and prevention of communicable diseases in the country. He was on the front lines of Nigeria's fight against COVID-19 and was a very calming figure for those of us who lived through those troubling days. Dr. Ihekweazu trained as an infectious disease epidemiologist and has worked in senior public health and leadership positions in several national public health institutes, including the National Institute for Communicable Diseases in South Africa, the United Kingdom's Health Protection Agency, and Germany's Robert Koch Institute. He has led several short-term engagements for the World Health Organization, mainly in response to major infection outbreak around the world, including the dreaded Ebola virus in Liberia. Chikwe, welcome.
Thank you, Patrick, and thank you for the work you're doing, driving thought leadership on some of the topics that are most important for us. So really excited to be on your show and the opportunity to share a few thoughts on the work we've done.
Fantastic. And we're living in quite interesting times here with profound challenges across multiple domains: global health, democracy, technology innovations, climate change. Hopefully we can cover many of these topics today. But let me start by again congratulating you and your wife, Vivianne, on your recent book, An Imperfect Storm, A Pandemic and the Coming of Age of a Nigerian Institution. I mean, it chronicles Nigeria's response to the COVID-19 pandemic, through the lenses of NCDC. So my question is, what motivated you and Vivianne to document this particular institutional journey at this specific moment in Nigeria's public health history?
Yeah. So thanks, Patrick. Let me answer this question in the most honest way as I can. I think many of us, as we go through life, you think that maybe there are aspects of it that might be interesting for others. So as we went through this pandemic, no doubt we felt, this was unprecedented. So there were decisions being taken there wasn't anything to reference on. So, and every day, it got more. Imagine the decision to shut down a country, to shut down the airspace, to stop people traveling, to close schools, to close markets, so these were big decisions. And every night I would come back and tell Vivianne, listen, you wouldn't imagine what we did today. We were testing Mr. President's family because his chief of staff had just tested positive, So there were such monumental decisions. And I would get home at 11 p.m. or 12 p.m. and she would be awake waiting for me, and I'll share my experience of the day as quickly as possible so we could still catch a few hours of sleep. And she was making notes. And it was these initial notes that led to having something to start off with. So I think a lot of the credit goes to her for those notes that she kept. If not, the idea of writing a book would have remained as an idea. So One thing is wishing and wanting to do something. The other thing is actually being able to do it. So those initial notes enabled us to have the first 10, 15 pages of what would then become the manuscript of An Imperfect Storm that we put together. But we felt, listen, we knew, and this happened, that there will be a lot of literature coming out of the rest of the world because this is a pandemic that we all went through together. And we didn't want to end up almost as usual, being only recipients of wisdom, that we wanted to contribute to the historical account of what we had gone through, but also hopefully make it an enjoyable read for people.
And indeed, it's an enjoyable read. And let me again thank Vivianne for those early notes and also for the discipline and the time and effort spent putting together the book. Yes, there's a lot of knowledge, literature coming out on COVID, but I don't know that there is one on how an institution, with all of its many challenges, rose to the moment. And so for that, we must thank you for documenting. So, and the title, An Imperfect Storm, can you help us unpack what that means?
An imperfect storm, firstly, there's rarely a perfect storm, but we kind of, when a storm is coming, very often we are able to sometimes anticipate the damage that it will cause. But I think with COVID, firstly, is the fact that none of us really understood what was going on. We were trying to figure it out as we were in it. And all the aspects of it, a new virus circulating, so many unknowns, the impact it would have on the population, countries affected, on the economies of countries, so the fact that there wasn't a manual that we could follow other than our professional instincts based on the work that we had done in the past. And then in the incredibly complex context that we live in Nigeria, the fact that there's very little trust in government altogether, and this is not criticizing the government I served in. This was before that government, during that one, and subsequently. But there wasn't any other way. This isn't something you could ask the private sector to lead on. Like many of our other problems, whether it's electricity or our telephony, when government fails, you ask, why doesn't the private sector come in? In this case, it wasn't an option. The public sector had to deliver. So that's kind of why we thought about this name, both the imperfections of the context of the health challenges, but also the imperfections of the political and socioeconomic context in which we all had to respond. And there wasn't any running away. We couldn't jump into our private jets and go to Europe. It was closed. Yep. So we had to sit down in our own context, despite all the challenges, and manage it within that context. So I think that's what led to our choosing this name for the book.
Exactly. And I'll come back to what you touched on in passing about private sector's role in global health. But before we get there, before leading Nigeria's COVID-19 response, you had managed, or at least worked in a few other outbreaks like Ebola, Lassa fever, and other infectious diseases. How did these early experiences shape your understanding or approach to institutional building at NCDC and inform your current work at the World Health Organization?
Thanks, Patrick. I'll answer that in two ways. Firstly, on the professional path, in the work we do in public health, very rarely would you see a doctor that would tell you very early in his career that public or population health is his priority. We all are, most of us are driven by the euphoria and satisfaction of solving clinical problems for individual patients. So, and that was my path for my early years. But when I, having trained in Nigeria, I got a really random opportunity to be engaged in public health, and then started working in national public health agencies, and recognized that a lot of the challenges in our country and the way healthcare is delivered is not really about the expertise of individual doctors. And that's also is demonstrated by the incredibly successful cadre of the export of Nigerian doctors around the world. But really, it's about how do we organize ourselves as a country to deliver on healthcare that is very complex and protecting the health of individuals. The second point is on institutional building, right? I fundamentally believe that we cannot build our country if we don't build our public sector institutions. You know, in the private sector, there's an incentive to build great companies, and we have demonstrated that we can build great companies in many aspects. But in the development of public sector institutions, I think that's work in progress. And that's why another reason I felt it was so important to write this book. Like you rightly said in the beginning, I think maybe half of it is about COVID and the response and the personal stories around of it. But the second part, and maybe the part that is more important for me in the future of our countries, what it takes to build a public sector, a functional public sector institution, and the fact that it's not rocket science, it can be done. And I hope that in the 5 years of work that we did at NCDC, we demonstrated that this is possible so that others can also not give up without trying and can build on some of these lessons and go ahead and do greater things.
And I, like you, I really like that second part of the subtitle, which is the coming of age of a Nigerian institution. Can you help me just elaborate a little bit on the key transformational moments that marked NCDC's evolution from the point when you met it to when it had to face this, really unprecedented black swan event that nobody in the world kind of prepared for, and how it was able to rise and become that Nigeria's primary public health institute that gave us hope and that we felt could help navigate us out of this thing that we didn't quite understand?
But let me start at the end. Sometimes in the later stages of the outbreak, when I would board a flight in Nigeria, and every airline would make this announcement that following NCDC guidelines, you had to do 1, 2, 3, 4, 5. I almost felt, am I in what world am I living in that this small parastatal is defining how we all are behaving, right? But thinking about it in retrospect, I shiver when I think, we had 3 years to prepare for a pandemic that we did not know was coming, right? I shiver to imagine if we did not have the 3 years, because it almost feels, if you read this book, it's almost, you feel that, listen, is there a way these guys working in this place knew that something was coming in 2020 and started building? We didn't. So our primary instinct wasn't to prepare for a pandemic, it was to build an institution. So if you think about the moments, it's hard to define these moments because in a way, it's a very boring, tedious process in terms of the work that was happening. It wasn't exciting. It wasn't something you could cut people to cut ribbons. But, we have to imagine the state of play when we started. When we started, and just how the business of government works and the opportunities to improve. When I was appointed, nobody gave me a letter appointing. If you tell this to people outside, no one discuss. No, and it's not like this was just in that era. It's still happening today. I was told that I had to find my letter in somewhere called the Office of the Secretary of the Government of the Federation. Obviously, I'd never worked in public service, so I had no idea where it was. So I had to find someone that would take me to this office, and they would go through a series of files, and they opened the locker somewhere and pulled out a letter, and and then I could actually, because other than that, I just had, what was in the media. And so the point I'm trying to make here is there's no example of a successful country that has grown without building an efficient bureaucracy to serve the country. And we have to really focus on the building blocks of a country. So the letter is just one example. The institution I was asked to lead had no act establishing it. So I couldn't be given a tenure of how long I would serve because there wasn't any definition of that tenure because we didn't have an act. So the first defining moment for me, the almost most important one in my first couple of years, was taking a bill, firstly writing the beginnings of a bill and taking it through our houses of parliament, the House of Representatives and the Senate, and through the readings and the subcommittee hearings, the public hearing, and ultimately doing the legal drafting with the drafting committee. You have to learn all these things, and ultimately getting it signed off by Mr. President. And NCDC was one of only 2 new parastatals that were established under President Buhari's tenure. So he was very conservative in the establishment of new parastatals. So I think that carrying out, leading the process that led to the act and everyone that supported that process, for me was a defining moment. And then there were many, many others in terms of the teams setting up a first emergency operations center, taking over the field epidemiology training program, going around the states and just leveraging on the power and support infrastructure of the state. But ultimately, I think it was the response to the COVID pandemic that really put NCDC in the consciousness of Nigerians. And I hope, despite the various, limited resources that we had, that at least we didn't add to the plethora of stories of occasions that the country failed its people. And that at least on this one occasion, I wouldn't say we were extremely successful, but I think I can start by saying we did not fail Nigerians. And to me, that in itself makes me incredibly proud and shows me that many things are possible in our country.
Yeah.
The odds.
I want to stay on this question a little bit further because, so many people in the private sector, folks who haven't done work in government, may think about doing work in government, but they don't understand how broken things are and how they need to dig very deep within themselves and their character to find, the motivation, the inspiration to build these institutions because they're important. I remember the early days of NCDC. You had actually invited Nextier to come do some pro bono training for your people, and we did that because we trusted in, your leadership, et cetera, et cetera. We didn't even know that COVID was going to come. But if you could just walk us through some of the mechanics of the very mundane things you had to do to build up this institution, not knowing that you had to face a global pandemic, and what were you thinking? What was the motivation? Because I think it could be useful for some other people thinking about going down this line.
Yeah, so Patrick, firstly to say thanks a lot for your support at the time, and for which I was very grateful. But sadly, I must inform you that you were not the only one in my network that I tapped into. I literally tapped into everyone I knew that could do anything that I thought was helpful for the work I thought we needed to do, which brings me to the first point to answer your question is, this is not a walk in the park, right? To take up public sector leadership is an opportunity, it's an honor, and it's something that we really have to, if you decide to do it, you cannot do it as a side gig or, be preoccupied by other issues. You really have to devote yourself to it fully. It's very rewarding, I can say that for free, but it is hard in the beginning, especially in our context. But it is possible. Something that we have in our context that I have rarely seen in any other country, especially on the continent. And many people have said this, but I'm a living witness to it. I'm not saying it hypothetically. It's the energy and the entrepreneurial energy of our people. But it's very hard to see because you could enter an office and you see a civil servant, and this anecdote is used a lot, eating granite and banana and appearing not to have anything to do. It is the same people that when you're able to unlock the thing that is inside of them, that will go over and beyond to deliver on something that they believe in. But it will not happen on its own. And in government, there are not those incentives that naturally lead to high-performing organizations. It's just not there. So you have to bring them in somehow. And when you come into a new government parastatal, people often they're excited in the beginning, but they think, this one will come and make noise and then go back and he'll be the same as others, right? So you also have to show them that you're in this with them for the long term. And I think once I got to that stage that they knew that I wasn't going away, I wasn't going to stop, and that you will come early, you will leave late. If you expect them to do it, you have to do it. If you expect people to do the grind, you have to do it. And if not, we're very good at pretending to do stuff. So I do think that running public sector institutions is not rocket science. We can do it. Our expectations are actually fairly low. So once you push a little bit, we have to push. Things begin to work. But we also have to recognize, and I don't want to be sentimental about this, public servants are paid very poorly in our context. And to expect miracles out of people that we are not paying is a miracle. And miracles we know rarely actually happen. So
actually, that was supposed to be my follow-up question.
Oh.
But how do you motivate people who are poorly paid? How do you get them? How do you unlock that spirit? You talked about unlocking that thing in them that gets them to do the work. Poorly paid, not well remunerated. Some of them might feel this is a dead-end job. They took it because they couldn't find something else. How do you get this same group of people to rise to the level they rose, during the COVID?
I can't have the answer for every other sector, but I can share a few examples of what we did. Firstly, the one I shared of yourself role modeling the things you want colleagues to do. Secondly, I had to show them that I was also interested in their own progress, right? So every single opportunity, you spoke about the one you came to do for us, the same way. I worked abroad for many years before coming back to Nigeria. So I had a broad global network. Every institution I worked with, I asked them, listen, how can you support my team? Can you offer us training opportunities? They say, Chikwe, they say, okay, we'll find one. I say, can you give us 3? We're a big country. We might end up with 2, right? Up till today, 3 colleagues from NCDC are today in Japan finishing PhD programs. I hope they come back. They are the future. So there are many of those opportunities that, yes, led to the development of the institution, but also led to the individual progress of the people. And you have to when you lead an institution in Nigeria, you can't just be an MD. Your father, your mother, your problem solver, your family mentor, you have to take the whole package. So I think it's a combination of factors, but I want to end not on a euphoric note. I do think if we want our country to work, we have to think of the whole thing, our public service. I left fairly happy with the work we did, but I now, on reflection, know that we cannot change Nigeria one parastatal at a time, or one ministry at a time, or one DG at a time. We need to really think, if we want our public service to work, what are the fundamental changes that we need to make our entire public service work? And we won't be the first country that has done. We don't need to go to Europe. We need to go to countries like India, like Mexico, like Brazil, to understand what makes their public service a little bit more advanced than ours, and take the best ideas from these for our own context.
And I know you've given it some thought, and we will definitely come back to that question. But I wanted to spend a bit of time talking about that COVID period and how leaders have to make high-stake decisions with incomplete information. So when you walked on stage every night and spoke to Nigerians, it gave us hope. We trusted that what you were telling us was true, but we also knew that you had incomplete information. So how did you navigate that tension in Nigeria's response strategy?
So, Patrick, this is a very hard question, and it's one I struggled with. And at the time, I wasn't even sure that we were succeeding, because I had different influences and, sources of advice. And sometimes the advice was, listen, don't share this with people. Others, had a different point of view. I think my basic principle in communication is to be as honest as possible. And this is not always the advice most government leaders are given. And very often we're advised to, manage information and, don't scare people or don't give them too much. But I tried to be as honest with Nigerians as I possibly could. One reason is, people are smart. There's a lot of information out there. TV channels were running 24/7, there's social media. So it was almost impossible. I tell you, one time I ran into a little bit of a problem, and I shared it in the book. We were running out of reagents at a critical point. It was a Friday. We had just scaled up our testing, but one critical reagent, our normal suppliers didn't have any. But I knew, this is Nigeria, I knew someone would have this thing somewhere in this country. So I put out a tweet, or what was that? Twitter is now X, asking for this particular reagent, right? Nigerians came after me, hammered me. You guys are unprepared. Why are you going on social media looking for basics? You should have had this and blah, blah, blah. But, and I wasn't, the first hour, I wasn't sure. I said, man, what have I done? But, right about an hour later, I got a call from someone who knew someone and said, listen, I found someone that can supply this. They will bring it to NCDC today. Don't worry about paperwork. We'll sort it out next week. Don't worry. I trust you, and I'm delivering this to you. So, on the one hand, I had been battered publicly. On the other hand, I was right that somebody in our country that we criticize so much was ready to give you, literally millions of naira worth of what you needed without any guarantee or assurance that you would actually pay. So in that hour, you saw the best and the worst of our country. And that's really why I think there's so much in it. And to make these hard decisions is never easy. It's always a little bit of a gamble. And you just have to trust your instincts and do the right thing. And more times than not, I think you will come out vindicated.
Fantastic. Now, let's switch a little bit to the World Health Organization. From your very unique vantage point, what do you see as the most critical gaps in global health surveillance systems today, particularly in the global south? And what innovative solutions show the most promise in addressing these gaps?
So I think if I start with the challenge and I'll get to the opportunities, the challenge obviously is that the people that we expect to do this work are the same poorly paid civil servants that we've talked about. And some of us, when you're in Abuja, you maybe even have access to some resources, and at least the city is fairly decent. When you think that where the biggest risk for the emergence of new or old infections is not in Abuja city center, right? These are in the most challenging contexts that we have. And that is where we expect the most important work to be done. So it is hard. Our country is big and complex. We have a very high population density in the middle of the tropics. So if I were a virus and I would think, where should I come out? Nigeria is probably one of the best places in the world to multiply, right? Flip it to the other side. The opportunity is, the technological opportunities that we have today in data science, in analytics, in laboratory diagnostics are incredible, right? So it enables us incredible opportunities to detect, probably to respond. But we have to bring this together. And I think that's where institutions like NCDC and similar institutions, especially at the state level, are so important. And these are not things the private sector can solve. And I think in things like public health, our justice system, to an extent, police, the areas where our criminal justice system, the areas where, unfortunately, there are no examples of successful outsourcing to the private sector, that every country has to define the investments it needs to make for these things to be delivered by an effective public service. So there are opportunities, there are challenges. If we had a good public sector, we can bring these together and create value for our country.
And we're again back to this private sector. What role can it play? The COVID-19 pandemic highlighted these very stark inequities in global health resources and vaccine access. The private sector stepped forward in Nigeria. COVID, stepped forward in a big way. Gavi and a few of these associations also played a key role. Multilateral institutions helped. Are you saying that there is no way, given that we know where the governments in Africa are today, we hope that they transform, we know it's difficult. Are you saying there's no way the private sector can bring more of its abilities to solve problems, bring some market-facing solutions to the global public health challenges we face? There's got to be a way.
Of course they can. Of course they can. And it's in that intersection. Let me give you another anecdote out of the book, which I hope everyone on your show reads, and those watching it later. Just in 2018, I started in 2016, 2018. I was trying to set up a foundation to support the work that NCDC was doing. I thought this would be a no-brainer, given the Ebola experience just a few years ago. So I went around our big conglomerates in Abuja, in Lagos primarily, and Port Harcourt, knocking on their doors, writing letters, setting up meetings. I did manage to gain a few meetings here and there, but nobody gave us any check, right, of any amount. So, after putting a lot of effort, and there was a big meeting in Lagos, I got both my ministers of health and the minister of state to attend. Everyone attended. Everyone said the right things, but nobody put any money on the table. Fast forward 2020. First few months, my phone was ringing off the hook. I'm MD of this. I'm calling from offshore. I'm manager of X. Everybody wanted me to pay specific attention to their needs. How do they manage their group of execs or their expatriates or people offshore? And I said, guys, I was literally begging you guys to support our work, and you didn't think it was important enough. So anyway, at the end of the day, together with Zuera in the Dangote Foundation, and a few others, we agreed, listen, I don't have the mental bandwidth to speak to each of you individually. Can you please help organize yourselves? Thankfully, Zuera were thinking in the same direction. And then they took on the responsibility of organizing themselves, formed CACOVID, and came back to us and then asked me, what are my priorities? I said, these are the areas I would like you to support. They took our advantage time, apart from the building of the isolation centers and stadiums, which I never advised, but happened. But in most of the other areas, credit to them, they took our advice, supported us together. My lesson out of this, and I think, is we can't invest in our fire service when the fire has started, right? It's a waste of everybody's time, effort. We need to be able to support. If we think institutions like NCDC are important, we need to set aside part of our corporate profits to say, listen, how do we support these institutions that are important to ensure that when our bottom line is threatened, they are there for us. And I think, Patrick, that's really how I don't think the private sector can do our work, but they can definitely support the work we're doing through innovative arrangements that happen around the world. But we need to find this intersection in our own context in a way that will work for us.
Is there a particular message that we can be passing across to the private sector now to say, thanks for what you did during COVID, but this is what you should be doing now that we don't have another pandemic, in preparation for the inevitable, but also in building up our health systems? Is there a way we can shape that message that it can resonate with the private sector and bring them to the table? Just from your reflections.
No, I think there are many ways. I don't want to go into specifics, but just this awareness to think that these things are not, you can't deal with them in a hurry. When COVID is shut down, I, I I wished I spoke to lots of people around us. It's how do we sustain it? We don't need to sustain it at the levels of investment, but maybe tone it down a little and use that vehicle to continue engaging. So, there are the advice to the private sector is, health is the solution to health problems in small groups is extremely inefficient. So the biggest, most efficient way is the pooling of resources. And the one big thing we have in Nigeria is people. So whether you're planning to provide access to healthcare or whether it's a public health intervention, the more you pool your resource, the more efficient your spend is. And this requires thinking. It's not a brick and mortar problem to solve. So, the more we can bring in our thinking and bring our health sector leaders together to force these very important, intelligent, but sometimes divergent groups together, then we will find the solutions. Let me answer it in that way rather than be very specific on what specific.
Exactly. And I'll get maybe one or two more questions in and we'll turn it over to our audience. Please, if you're participating and you have questions or comments, use the Q&A tab, not the chat tab, but the Q&A tab to post your questions. And that way it's easy for me to get to them. And I'll do full attribution for whomever puts the question forward. But Chikwe, looking ahead, what emerging technologies or approaches in disease surveillance excite you the most? And how might they transform public health responses, especially in Africa where we have resource limitations? What do you see things like AI, doing, and how could they be relevant for us in Africa?
Very good question, Patrick. I'll answer it in three ways. Firstly, before we even get to AI, there are incredible opportunities in diagnostics these days. So with new technology around genomics, around sequencing, there's so much of the previous steps in diagnosis that we can skip by using new sequencing technology. It's a fairly cost-intensive to install, but once it's there, it serves many purposes, and I know the efforts going on at the moment to do that. Secondly, I will get to AI as my last point because it's very important. But prior to that step, you need to bring AI only works on data that is available. If you don't have a pipeline of data coming, AI will give you the completely wrong conclusions on what is coming in. So our systems at the moment are so separate from each other. Very few hospitals are connected to each other. Very few hospitals are connected to labs. And this is not private or public, across. The supply chains are dysfunctional. Everyone is buying his own medicines from individual stores. So it's almost impossible to link the data being collected by these different systems. So I think before we gain the full value of artificial intelligence, we need to invest a little bit in the pipeline, the plumbing, not even the pipelines, the basic plumbing in our health sector and in the other areas in terms of our population numbers, our care providers, and all of that. So I do think, and this is not just for health, I think in many other sectors in Nigeria, to fully optimize the opportunities of advances in technology such as artificial intelligence. Unfortunately, there's a lot of stories about leapfrogging, and everyone talks about the mobile telephony leapfrogging the landline era, which I agree there are some examples. But in many other areas, unfortunately, to gain the benefits of new opportunities, we have to invest in some basics. We have to know how many of us there are in Nigeria, as an example,
Exactly.
for start.
Exactly. Exactly. So I have a comment from Pius Okigbo Jr. He says, Dr. Chikwe, I thank you for the work you did during COVID. Your comment on strengthening our institutions boil down to ignorant politicians and leaders who don't understand the significance of strong institutions in growing democracy. So my first question is it really ignorance, or is it more competence? So that's my first question out of that comment. Then the second question goes back to a point you made earlier on in our conversation, which is really, how do we make the public service work, in an entirety, not just the individual green sprouts we see from time to time. So is it an ignorance or competence issue? And then how do we make this thing work?
If I had the answers, probably I might be heading for a big prize somewhere. So for sure, these are tough questions, and we all live in a tough country. But let me answer by reflecting on one anecdote. One of the people I admire most, and many of us do, is Madam Ngozi Okonjo-Iweala, who has become a dear big sister to me, especially in the context I am in Geneva at the moment. And so in a quiet moment, in one of my last opportunities to speak with her in a social event, we were sitting in Geneva, and I asked one of the questions I like asking about what, in her so many years of public service, especially in Nigeria, what are some of the things that she's proudest of? And if you read a lot of her reflections, or the reflections on her work, her incredible work around debt relief for Nigeria would be one of the items very high on the list, and there are a few others. But she shared with me that it was things like instituting IPPIS, the system through which every public servant is paid in Nigeria at the moment.
Mm-hmm.
And so, 30 years of history of having ghost workers, disappeared or was at least minimized to the barest minimum. So those institutional changes in the system that eliminates the opportunity of individuals to maximize opportunities for themselves in the system, so these are the things, and it's not like we don't know what they are, but it is, do we have the courage to make these changes to tighten up our systems? If you look in the papers today, Patrick, you will see very few public sector jobs advertised, as an example, right? You can look on The Guardian every Tuesday. You see jobs from everywhere. You will see very few ministries, very few parastatals. So this is not something that the director of one parastatal can come and say, okay, I will advertise my jobs. But with a single policy change, we can stop that in the entire public sector. The fact is that once you do that, it disables a lot of opportunities for the advantages that people have. So my point is that what we need to do in our public service, public sector, none of this is new. We don't need great innovation. We just need to do the things we know we can do that have been done in many other countries. And we will begin to see the change happening. Fortunately, no matter how hard things are, because of the large Nigerian population, we will always find the talent in that pool, because people thrive to achieve. So we have a rare, incredible opportunity, but I think the thing lacking, and my brother talked about politicians. I will not make any value judgments, but I do think we need people with courage to do the things that we know need to be done to get to where we want to get.
Fantastic. Another question from Spencer Obiano. So with your experience driving during the COVID-19 in Nigeria, would you say NCDC did great, irrespective of your opinion? What are some of the things you could have done better or would see improved upon in the that NCDC should improve upon today?
So thanks. I'll leave the judgment of how NCDC did to others. We put out this book out there, and I hope colleagues read it. I think ultimately, my reflections, I said this earlier, is that too much is left in the hands of our leaders to do good or to do harm. I've managed, and today I manage a budget in multiple times the size of NCDC, right? My latitude in how I can move resource from one point A to one point B for anything is limited. There are so many checks and balances in the entire ecosystem of what you can do. And that is important. None of us is, we're all vulnerable to different instincts, and to rely on each individual's own ethics to drive our public institutions will not work. And we need to put in, solidify the ring fences around the opportunities in public sector leadership and drive it collectively forward, so that we stop talking about as proud of them as I am. We don't want to be referring to the period of NAFDAC under Akunyili or EFCC under Ribadu. We want the institutions to to be the things we remember. And when I was leaving SDC, I said my biggest wish was for me to be forgotten, and for the lasting memory for Nigerians to be the institution as it grows from strength to strength.
Fantastic, fantastic. I have a question from Valentine Achum. He said, COVID-19 was one of the most significant public health crises of the 21st century. Looking ahead, what emerging global threats do you believe is being underestimated today, but has the potential to cause a major crisis in the future?
In the work we do, the challenges, these threats emerge all the time. There's never a time where from the beginning that new virus or that new cluster of cases happening in Namibia or in India is the one that will lead to a pandemic. So you have to deal with each incident with the same level of urgency every day. I used to tell people in Nigeria that every day, every incident happening could be the beginning of a new pandemic. So we have to be able to detect and respond. I just came back last week from the Democratic Republic of Congo, where we're dealing with a significant Mpox, a new clade of Mpox that is spreading. Most cases have been reported in Uganda, Burundi, and most of them in DRC. And, these are hard challenges. And this is the context of significant socioeconomic challenges already. So our work is not precise. It's not one thing leads to another that leads to another. So it's fairly complex, and that's why a specialized organization like NCDC is so important for every country to have. Our own is growing. I met it with 70 people. I left it with 500 super motivated colleagues. But it shouldn't end there. We have the equivalent organization in the US has about 20,000 people working for it. So yes, we moved a little bit, but there's still a long way to go and a lot to build, and we have to keep working on this.
Fantastic. Francis Ayomo, the recent funding freeze by the US government to WHO and most US government-funded interventions in countries like Nigeria should be a wake-up call to stimulate domestic resource mobilization for healthcare. How do you think we can get the government and private sector in Nigeria to respond appropriately to get Nigeria less dependent on external financing for healthcare? Dr. Francis Ayomo.
The super, super important question. Of course, I regret, like many of us, the sudden suspension of funding for many global health programs. I think the suddenness of it will cost many lives, and I hope there's a reversal in many of those cases. But the point Francis was making is super important. Why are we building airports for ourselves, but we are not disposed to providing medicines for people suffering from illness, or provide our own vaccines for our own children? what makes us outsource our health protection, but have the resource to build airports, flyovers, whatever. I'm not saying these things are not important, but why do we consider it so unimportant that we're not investing in it ourselves? So I do think that the current circumstance must spark an important debate and make us less vulnerable to one superpower pulling out, and then all of us are afraid on the continent on what happens next. So I really regret the events happening at the moment. I do think these big decisions can be better planned and implemented. And if a country wants to reprioritize its expenditure, it's absolutely its own prerogative to do so. But when you've supported a certain thing for many years, lives depend on it. So, but I do hope that this is a wake-up call that for Nigeria and many other developing countries, that we need to take our destiny into our own hands in these things and invest in the things that matter to us if they really matter to us.
Exactly. Question from Chinelo Ugu. Thank you, Dr. Chikwe. Nigerians are known to celebrate success stories without an idea of what they cost. Were there times you were frustrated by bureaucratic, inefficient systems, etc.? If yes, how did you handle those moments? I guess, there could be lessons in here for people who are going through it or may have to deal with it in the future.
Yeah, no, there are many times, and I'm always grateful to my wife, Vivianne, and to, my family and friends and everyone that supported me throughout the years in service, because it was a collective responsibility for all of us. And the same challenges every Nigerian faces. When you're in government, it doesn't make you immune from them. You're still faced with the same challenges, and very often inside of government, there's a lot of trying to find your way around issues that are not straightforward. It's not like you can pick up your phone and solve problems. So it's the challenges that we face is nothing protects you from it. Maybe you have a little bit of extra leeway here and there. So I think our government is a reflection of the society that we have created. When we're ready to make hard decisions about the people we choose as our leaders, we will get the government that we deserve. Until we make those political decisions, we will have exactly the government that reflects the country and our values. I know that is an oversimplification of a very difficult challenge, and many people will come back to me and say, yes, but the elections and this and that. But ultimately, I think that we cannot rely on the coincidental emergence of people through good luck. We have to really raise our voices a little bit louder if we want the change that I think we seek in our country.
I have a question here from Chinedu Anarado. Your departure from NCDC was quite abrupt. Some of us who worked for implementing partners were quite shocked, given the successes you recorded from containing COVID-19, the mileage yet to be covered in outlining a disease surveillance playbook, and your ability to mobilize external support. What was the unspoken driving force? I'm sure you get this all the time.
No, it's a tough question to answer, because in a way, my heart is always in Nigeria. I can be out for a while and do other things for a while. But, having done that job for 5 years, and it was a tough role through a big pandemic. And a different opportunity came to serve Nigeria in a different way, So I believe that in the global space I am now, of course, my primary purpose is much broader. I have a global responsibility, but I also think I'm representing us, and I'm conscious of that responsibility every single day. That wherever I appear, wherever I speak, and whatever I do, I carry 200 million of us on my back, to support me as I represent you and make sure I try to do that the best I can every day.
Mm. And as you know, I mean, health monitoring and delivery systems are difficult in even saner times. And given that Nigeria has all of these conflicts, going on, this question is from Ndungokolo. How can Nigeria improve its health monitoring and delivery systems in most of its conflict environments? Are there some thoughts you have on how we can do this and do it more efficiently?
Yeah, in all these areas, and I've alluded to this a little bit, we have a context where we celebrate a lot of successes in different in different spheres of endeavor. We're great entrepreneurs, we're great performers, the individuals that drive successful companies, and there's very little space to focus on the hard grind that many sectors have to do to keep the rest of the country working. And I don't have clear answers, but all I can say is that I worked in a context where I saw that it was possible, where people were pushing every day. You come to NCDC on a Saturday, you see the car park half full with people. But it took a lot, and those short periods are not enough. It takes a collective mobilization of Nigerians to make our country work again. So it's complex. There are multiple layers to this challenge, but I left believing it was possible, and not just believing because I believe it can happen. I saw it happen for 5 years, and that gives me hope that with the right leadership, with the right motivation, that we can turn things around in our country.
There's a question here from Henry Wanguma. Where can we buy his book? Any public presentations planned? I can answer these ones. The book you can find in any major booksellers in Nigeria. Many of the bookstores carry them. Roving Heights is always a good place to go. Amazon, obviously, for those who are outside Nigeria. There have been a couple of public presentations, including at Roving Heights, in DC, in London, etc. But I don't know if there are other public presentations planned. Chikwe.
No, we've done a few. We did Lagos, Abuja. So, to be honest, I have a full-time job. I'm not looking to be a best-selling author. I really want, this is important for me, just having these conversations on the book. So please get the book. They're available in Nigeria and Roving Heights bookshops, specifically at airports, on Amazon, globally. And, if there's an opportunity to speak to any group, small, I will always consider the opportunity if time and opportunity come together.
Exactly. Thank you. And I appreciate the time you made for this discussion. And I know how difficult it was to fit it in. And, just to say that we really appreciate it. I have a question from Stanley Ibe. Chikwe's point about approaching reforms in the public sector holistically caught my attention. I wonder if you could share a few ideas about how you might do that as, say, Minister of Health. What are we doing wrong at this time, and what can we do better?
Oh man, this is a theme for a full
session.
series, actually. But let me give an example, because I don't think any of these things are not hard, but it's courage to do it. In my previous teaching hospital, I studied in the University of Nigeria teaching hospital in Enugu. I went back at some point, and I went to the Obs and Gynae department. At the time, this was a while ago, there were about 25 consultants working in the Obs and Gynae department. I asked about how many deliveries, how many patients are we seeing in a day. I got a number that is completely out of sync with the number of consultants. So, okay, how often are you coming in? consultants barely come in, some come in for a few days. This is not to criticize them. I'm just saying that at the moment, the numbers don't add up in any sector, right? The number of patients don't add up to the number of doctors that are seeing them. Therefore, enough revenue is not generated. Therefore, the hospital is not sustainable. Therefore, it requires huge subsidies. Therefore, it will never work. You can do the same calculation. Students in Nigerian universities are not paying enough to be taught. Therefore, they're not being taught. Therefore, they're learning outside or managing or leaving 20 in a room. Therefore, our universities are failing. Therefore, graduates are poor. Therefore, we're not getting the human resources to fill vacancies. In almost every sector, you can do the maths. And as long as the maths is not adding up, no miracle will save the sector. If we're not paying appropriate pricing for electricity, companies will not be able to generate, the companies will not be sustained, the sector will not work. So this is not unique to health. My fundamental learning is we have to treat the country as any other endeavor. If input doesn't match output, doesn't match impact, ultimately it will fail. So we need to connect the dots. Once we connect the dots, we will begin a journey towards a country that works. But until we do that, until we have the courage to do that, we will continue to patch the holes and hope that new holes will not emerge. And we know that's against the laws of nature.
Exactly. So I have a set of comments and questions from Pastor Oyewole. He says, Dr. Chikwe, many thanks for your services to Nigeria during the COVID-19. You are highly appreciated. Now, to my question, our primary healthcare centers are presently in a shambles. The secondary and tertiary healthcare centers are not enough, overstretched and ill-equipped to take care of the bloated population. Today, healthcare in Nigeria is only accessible to the rich, the wealthy, and the connected, while majority of the masses are dying of diseases that easily treatable but are too poor to afford access to the services. What are your suggestions to improve access to healthcare for the masses? Yes, our political economy might be irresponsible. Even education and housing is a no-go area for the poor, but he's really interested in your comments. And I know you've kind of touched on many of these things, but you can see that the questions keep coming back, that people are kind of looking for you to help crystallize like a step-by-step on what needs to happen so we know how to engage with those who are currently managing the space. And I know it's difficult, but give it a shot.
It's a tough question, but let me address the first point, because there was an insinuation made that if you're rich, you're sure. I don't think that's the case. Yes, if you're wealthy, for some medical challenges that are chronic and you can plan for and you can mobilize resources, yes. But if you have a stroke, a cardiac incident, or an emergency following an accident in most cities in Nigeria, the fate of the rich is as good or bad as the fate of the poor. So there are areas that we have to think really how to drive out of this. I think one good thing is that at the moment I'm very confident with the current Minister of Health. Professor Mohammed Pate. I think we have the right level of intellectual capacity to drive the future of the health sector in Nigeria. It's a complex sector. People look at health in Nigeria as a drain on the economy. And this is a false assumption. In many parts of the world, the health sector contributes or accounts for 10 to 15% of GDP. So this is actually a sector that, if we think about it holistically with the expertise that we have, we can turn this from into an opportunity for our country with the human resources. But in a way, we have to connect the money to the opportunity and to the service. So without going into too much detail, let me just give one example in a way outside of public health. when in my own small family and circumstance, recently, a few years ago, I've gotten health insurance for everyone that I describe as a dependent one way or the other, and mobilize the rest of my family to do the same. Um, Now, you might argue, is health insurance working in Nigeria or not? Maybe it's not working the way as perfectly as in many parts, but it is working to some extent. And it takes a big burden off me. I can plan, I can define the resources I need to devote to this. But the uptake to invest in insurance policies in our country is very challenging because we have a lot of mistrust in insurance broadly, not to talk about health insurance specifically. So I do think in our country we have a fundamental challenge that we have been let down by government and by collective action so much that we always look for solutions where that we can take responsibility for solving ourselves, like building our own boreholes, buying our own generators, and solving for those. Unfortunately, health is the one area that is almost impossible to do so on your own. You have to work together. And that, in a way, is counterintuitive to the instincts of the average Nigerian to solve for myself. Without going into specific solutions, Patrick, because we just cannot get there within the context of the conversation, is that whether we're working as a collective, whether it's a school, a church, a family, a state, or a country, health is the one area where collective action is necessary to move the needle. We cannot move it if we think about solving it just for myself and my family.
Let me ask this question, Chikwe. Based on your experience at both national and global levels, what fundamental changes do you believe are needed in how we structure and fund these public health systems to better prepare them for future pandemics? So what are some of the things that we should be doing now with our public health funding, to ensure that we are better prepared and we're not scrambling like we did the last time?
So if I were Minister of Health, I'll start by starting a national conversation on how we want to fund our health system, right? So in the UK, for instance, they have a tax-funded health system, right? They understand that through our collective taxes, we will fund our health system to work. In many other countries, in Germany, for instance, they have a social insurance model. So tax funds are not used for health. Everybody pays, you pay, your employer pays, those funds are pooled and used to provide health services for individuals. Other countries have different models. In Nigeria, we haven't defined our funding mechanism to provide health. So some people the government pays directly for health facilities. We have basic healthcare provision fund, we have NHIA, we have private insurance, we have a lot of people paying fee for service. So in the inefficiency of funding, mobilizing funds, we have an inefficient delivery of health services. So I think there's a big need to have a conversation on how do we want to fund our health sector. And if we want to move away from tax funded delivery to health insurance, then we should move the money. But at the moment, we don't move the money. If you see a state, it wants to start a new state health insurance scheme, it continues to fund through direct funding of hospitals, then also starts a health insurance scheme. Meanwhile, patients are still paying out of their pocket. So we need to attract the financial gurus into our sector. And at the moment, there's no incentive for the colleagues that understand money to come into health. And you find doctors and nurses trying to solve financial issues. So it doesn't answer the question satisfactorily, I know that, but these are hard questions and how to bring these two opportunities together.
Yeah. And maybe another question along those same lines of just really policy and system change how can developing countries, Africa, some parts of South Asia, better leverage regional cooperations and South-South collaboration to strengthen their health security capabilities while reducing dependence on traditional donor relationships? And this question is important in line with, the Trumpian approach to these issues, and what it may then lead to, where these lifelines are cut off and these countries have to dig deeper to find a way out of where we are today.
Yeah, so this is a good question. We can go have many anecdotes. The current situation is one. I mean, during the pandemic, and something I referred to in the book was, and talked about a lot during the response, was when the Secretary of the Government of the Federation made a public statement that I know he regretted later, that he had no idea of how bad the health sector was until the pandemic started. But I do think we talk about South-South collaboration and opportunities. The biggest opportunity that we have for us in Nigeria, I know you have a global audience, is the human resource in the medical space. There's almost no other sector that Nigerians have been more successful individually, globally, than in medicine and health. Go to almost any big center in the US, in the UK, in Western Europe, you will find a Nigerian specialist. My wife was giving birth in London 20 years ago to my first boy. He was attended by a Nigerian nurse. So she was, across board. But at the moment, there's no intentional effort to leverage this opportunity that we have to serve our country. I know many of them have come back, and many of them are working. The best private sector hospitals in Lagos are run by Nigerian doctors that have come back to Nigeria. But we make it as hard as possible for every one of them. And these are my brothers and sisters with various groups together. They can tell you how hard it is, from registration to bringing in equipment to setting up to employment, every aspect of it. So what about intentionally setting up processes to attract these colleagues who in their 50s and 60s have probably solved many of their primary problems and want to come? So I think we have to see this as an opportunity for us. And once we start seeing it and seeing not only the opportunities for health, but opportunities for the economy, we will start doing the things that we know. You don't need my advice on what to do. I think we know what to do. But again, do we have the courage to do these things? If I came back to Nigeria as a doctor after practicing abroad, the registration process to practice in Nigeria, you don't want to hear how hard it is. Exactly. Right. Even to locate the Medical and Dental Council of Nigeria in Abuja and the office, you need a special navigation system to get to where it is in order to get registered. So I know the current director is trying to solve some of that, but man, we can make life easier for all of us with very simple things.
And whilst they're solving it for doctors, they should be also solving it for entrepreneurs like ourselves, who face.
You guys are better placed, for sure.
We're down to the last minute, and I want to gift that minute to you, Chikwe. I don't know if there's something you wanted to talk about that we didn't get to in our questioning. Maybe you can take the next minute to do that.
Yeah, no, thanks, Patrick. I really want to say two things. Firstly, it's many people ask, you wrote this with your wife. Yeah, this book would not have been written without Vivianne's input throughout. I referred to it in the beginning, but also the support throughout the time I served. And secondly, and finally, and we complain about our country a lot, and of course I'm part of that. We will keep doing so. But I just want us to take out of this story, because even though I wrote this book, if you read the book, you'll find the stories of many, many Nigerians I work with. These are normal, average civil servants, right? And the incredible work they did. And it is because of them that I still have hope for our country, because we have something in us that many others don't. And if we can activate that spirit in the right and give it the right support, I think we can create a beautiful country. And so I want everyone on this call session to keep believing, but to go back and do something about it in your own sphere of influence. So thank you, Patrick, for the opportunity.
Exactly. And thank you to you, and thank you to Vivianne. And thank you for being very generous in the way you recognized people, including some of the bankers who were the early adopters of what you were trying to do, et cetera, et cetera. That was very gracious of you. But to say to everyone who joined us, thank you for joining. This is the first in a series of conversations we're going to have this year. Last year, we had about 23 of these conversations. We're looking forward to having a similar number of guests this year. And my next guest will be Professor Darren Q. He's the Dean of the Kroc School of Peace Studies at University of San Diego. And we'll be talking about charting a path to peace, Nigeria's journey ahead. It's on Wednesday, February 12th at 3 p.m. West Africa time. And if you can, please join us again, and we'll have a fantastic time ideating on how Africa can solve its most complex development challenges. And again, Chikwe and Vivianne, thank you so much for this gift to Nigeria and for everything you've done and everything you'll continue to do. Thank you.